Hi, my name's Kim, and I'm going to be presenting today my project that I did at my hospital for this class. I'm doing the RN Oncology Review for 2011. So my project consisted of presenting a continuing education project for the staff members on my unit. I'm going to do an oncologic emergency, the superior vena cava syndrome. I'm going to look at new oncology medications, and then also I'm going to do an oncological skill, which will be accessing a venous access port. So my objectives for this project: the RNs will demonstrate the sterile technique for accessing a venous access port with 100% accuracy after watching a demonstration video. And then also the RNs will pass a post-examination with at least 70% after viewing material that was provided to them. My timeline: I started at the beginning of the quarter. I met with Eloise and Sarah, both clinical nurse specialists, to discuss the project. Then I met back up with them, gave them preliminary information, discussed timing, and I also met with Robert, who is our pharmacist, who does all of our oncology medications, and discussed any new oncology medications that came out recently. I also, on the 18th, announced the project at a staff meeting and hung flyers to notify the staff of the upcoming event. I met with Pam Clark on the Lines team to discuss accessing a venous access port, and also talked to her about possibly videotaping her doing the demonstration. Then I put together my presentation, my poster, my quiz, my video. And then I met with Sarah and Eloise again and got approval on all the information that I was going to present. On April 28th, I set up my presentation and I began checking off staff members on accessing a venous access port. This was done on their own time. It was done over a 2-week period. I had it available, so it wasn't a one-time presentation and check-off. People had to do it on their own time during their shift. So basically they would come in, they would get a packet, they would look at the superior vena cava poster and do the post questions on that in the packet. They would look at the new oncology medications within that packet and do the post questions on that. And then they would watch the video on accessing the venous access port. And then they would sit down with me and be checked off. I would watch them demonstrate accessing a VAP on the mannequin. I did come in on the weekend and check people off. I also came in early on a couple of my shifts, 5 o'clock in the morning, to check people off on night shift. And then I came in on some days to check off day shift people. So my presentation ended on May 12th. I collected all the people's post quizzes. I corrected them. I placed them in their education binders. And then I followed up with anybody who did not pass with the 70%. Today is May 17th, and I am doing my project presentation for Cal State East Bay. So my rationale for doing this: John Muir Medical Center in Walnut Creek is accredited by the Commission on Cancer, and we must present continuing education to staff yearly to keep that accreditation, and it has to be oncology driven. So my anticipated benefits: my benefits would be that RNs would become more competent in working with oncology patients. It would also benefit the hospital because their nurses would be more competent, and as well as, most importantly, it would benefit the patients because they would have a competent nurse taking care of them. Anticipated problems. One of my anticipated problems was that all staff members must participate in this project. They worked nights, they worked weekends, they worked, some of them are on medical leave or vacation, so trying to figure out all that information. Also, putting together a video for staff. I didn't know how that was going to work, and I figured that there might be some glitches, but I did actually figure out how to make it work. So, and then supplies for the skills to check off. The hospital did provide those supplies, but I couldn't use 56 central line dressing kits and Huber needles and other supplies that I needed for it. So I had to come up with being creative in going about using all those materials. As far as resources, I did have to buy a poster board. I did put together information packets. I was able to produce those at my house, and then I took them into work, and they let me use a copy machine, and I copied them there. I did produce the video, and I had already had a little video camera that I used, so it did not cost me anything else actually to use that video. Time-wise, I probably invested about 100 hours in developing and implementing the project, as well as the hours that I spent coming in to work with staff. As far as supplies for the skills checkoff, I did, like I said, become very creative. I was able to only use 2 central line dressing kits for the whole entire checkoffs. I would reuse water in the sterile syringes. We would just repack regular clean gloves into the sterile glove packs each time, and go about doing things that way. So we actually did save a lot of supplies and resources. Support from personnel, the clinical nurse specialist, Sarah Marshall, was my preceptor. She was great in helping me out with all of the information that I needed. Also, the pharmacist, Robert Swiderski, who was in charge of the oncology medications, helped me out. And then also Pam Clark on the lines team was very instrumental in getting the information together for the video, as well as teach me more about the venous access port. So materials developed. I did develop a poster board with the oncologic emergency of the superior vena cava syndrome. I talked about causes, nursing considerations, treatments, diagnostic tests, signs and symptoms. I tried to put on some different pictures and stuff so that it was easier for people to read it and look at. I also developed the video, and in developing that video, it was a 4-minute presentation that everybody watched. I just put a little section in here, it's only some of it. It's for you guys to watch.
Okay. Today's demonstration is going to be accessing a VAP in a sterile fashion. First off, you need to gather your supplies, your dressing change kit, your Huber needle, a sterile syringe, a clave, and some pre-filled syringes. Opening your dressing change kit, donning your mask, removing your sterile gloves, and utilizing the drape as a sterile field. You can take the syringe that's pre-filled. This should not be dropped onto your sterile field. This is not for sterile field. The solution inside is sterile. However, you can use it inside the cup. I generally use 2 syringefuls just in case you need to flush. First, you want to use your alcohol, starting at the port and working your way out to the margins of your tegaderm dressing. Pour prep. Wait for your sponge to get wet. And then a back and forth motion, friction to the port side. And set up your supplies over here. Remove your needle. And now you can drop your saline from your sterile cup. Attach your clave. Attach it to your Huber needle. And both hands are still sterile. Palpate your port site. Access your device. Withdraw. Flush. And then apply your dressing.
So other materials that I developed the information pack that had new oncology medications. I did a checkoff sheet for the skill of accessing the venous access port. I also did post questions for the superior vena cava syndrome, the new oncology medications, as well as some questions on the venous access port. And in the end, I included an evaluation that the staff could evaluate me on my project. I also, in that packet, like I said, was the new oncology medications. This is just an example of one of the sheets that was in the packet. The skills checkoff sheet for accessing the venous access port that was placed in the packet. And then this is the evaluation form that was also placed in that packet for people to let me know how I did. First one says the following information was useful to my nursing practice. The poster was helpful in learning about superior vena cava syndrome. The video was helpful in reviewing the proper sterile technique for accessing a venous access port. And the material was presented in an easy-to-follow format and made sense. So for as far as research went, for new oncology medications, I mainly got the information from the manufacturing companies that made the medications and accessed those online. For accessing a venous access port, I used John Muir Medical Center's Nursing Procedure Manual for central venous catheters. For information on the superior vena cava syndrome, I went to the library and got information out of books for all the information that I needed for the oncologic emergency. For evaluation criteria, the agency that I used was John Muir Medical Center in Walnut Creek. My preceptor was Sarah Marshall. And then measurements of my objectives, I used a post-evaluation survey and a post-project survey. Professional goals, I did learn a lot and gained a lot of knowledge regarding my oncology patients, as well as just putting together a project of this sort. So progress to date, I'm basically done with my project at this point. Any changes that I would make, I would find probably a better format for viewing the video. It might have been easier to have it streamed a different way so that it maybe went to people's emails so that they could view it in their own format before doing it, instead of me having to bring my computer in every day. I do know that they are going to use this video on the internet site at John Muir so that new hires or people that were on medical leave during this will be able to view that video in the future. So measurements of the objectives, those were those 4 questions that I asked people and just their responses that I got back. The following information was useful to my nursing practice. Most people strongly agreed. The poster was helpful in learning about superior vena cava syndrome. Most people agreed with or strongly agreed with. That wasn't as big as the hit. The poster wasn't. The video was helpful in reviewing the proper sterile technique for accessing a VAP. People liked, and then also they thought that the material was presented in an easy-to-follow format and it made sense. And that is the end of my presentation. Thank you for watching.